Okay, I think we'll go ahead and get started. Hello, everyone, and welcome to the Arizona Commission for the Deaf and the Hard of Hearing Town Hall on the ASL Interpreter shortage. My name is Cameo Hunsaker. I am the ASL Interpreter Professional Development Specialist at ACDHH. And today we're going to share some information with you from the results of our statewide interpreter shortage study. I appreciate so much that so many of you are interested in this topic and wanted to come learn more. So let's go ahead and get started. So to set the stage a bit, we are going to review some history about the ASL interpreting field. We're going to share survey data with you, which pointed to several key systemic issues that are thought to be impacting the interpreting shortage. We are going to discuss proposed solutions that we found from both our research and the survey responses. And then lastly, we will have some time for a Q&A at the end. Now, a couple housekeeping announcements. We appreciate everyone keeping their cameras and microphones muted. That lets those of us who are relying on the interpretation to see the interpreters clearly. For everyone else, we recommend using gallery view so that you can clearly see any deaf participants who pop on screen and join the Q&A. Also, you might notice that when I advance to the next slide, each time I'll be pausing for a few moments. That lets our deaf attendees be able to read the slide and get acclimated to the information before then having to focus their gaze back on the interpreter. We do also have closed captioning. You can turn that on by the CC button at the bottom of your Zoom screen in that little Zoom dock at the bottom. And if you don't see the CC button, you may have to press the More button, which is the three dots on the right, and you should see CC as closed captioning as an option. Now, as far as questions go, we do have two different ways that you can ask questions for the Q&A at the end. There is a Q&A button at the bottom of the Zoom in that dock. Again, you may have to press More to find it. Or during the Q&A, you can use the raise hand feature, and that's for if you'd like to come on camera and ask your question face to face. Lastly, we are recording today's town hall, and the recording will be available on the ACDHH YouTube channel in the coming weeks. Okay, before we begin, we want to get to know you all a little bit better. So we have a few brief survey questions for you to answer right here in Zoom. Give me one moment and I will get those set up. All right, can everybody see the poll questions? All right, I got a thumbs up. Go ahead and answer those questions and then we will get started. Okay, we've got about 75% of everyone on this Zoom having participated. So I'm going to give it just a few more seconds, and then I'm going to end the poll. So get your answers in. All right, we're at about 80% participation for the poll. So I'm going to go ahead and end it. And we'll take a look at some of these answers. So we've got about 10 community members from the deaf, hard of hearing, or deafblind community. We've got about 38 hiring entities, about 23 people from interpreter referral agencies, 40 ASL interpreters, 26 members of the public. Thank you for being here. And luckily, everybody knows why they're here. So that's good. About 28% of you took part in the surveys that we sent out. Thank you for doing that. And then this is the question that I'm most interested in. What do you think is causing the ASL interpreter shortage? So when we look here, let's see. The thing that got the most votes, so it looks like ineffective interpreting education programs, interpreter and advancements in technology, and interpreter burnout seem to be kind of tied for what people thought were the most impactful. Advancements in technology and interpreter pay, the interpreting test and interpreter education programs seemed to get a lot of votes for being very impactful. Let's see. About 30% of you thought that education programs were kind of middle of the road impactful. And the rest seem to get some smaller votes. So that's what you as the public are, your initial feelings on where the causes for the interpreter shortage are coming from. So we'll see if some of our data supports or refutes those initial thoughts. Okay. So we obviously are all here to talk about this shortage of qualified ASL interpreters that has been impacting the deaf community's access all over Arizona. All of us here at the town hall today have some kind of vested interest in the current state of the interpreting field, whether you're a deaf community member or a business that hires interpreters, or if you're an interpreter yourself. So what we'd like to do is first take a few minutes to understand how exactly we got to this point. Now, in the 1960s, the Registry of Interpreters for the Deaf was established as the field's first professional organization. The original goal was simply to maintain a list of people, a registry, who identified as sign language interpreters. But the founding group of RID were hopeful that the organization would someday become the certifying body for the field as well, which did end up coming to fruition. Now, after RID was established, there were several federal laws that passed pretty quickly after that, that had an impact on the demand for ASL interpreting services. And so by the 1970s or so, there was this huge unanticipated increase in the demand for these services. Meanwhile, the profession, which was still really in its infancy at the time, was just not prepared to meet that need. So what's interesting is that when there weren't enough professional interpreters to meet the increasing need, other people stepped in to help. Now, these people were well outside the norms of the profession. They weren't able to meet the performance standards from RID. They likely weren't even aware that ASL interpreting was an actual profession. They were just stepping in to be helpful. The result of this not only perpetuated the idea that anyone who knows little sign language could do the work of an interpreter, it also set up a completely contradictory pathway for unqualified people to provide these services. And when we're talking about people who aren't qualified to work as an interpreter, what we're talking about is people who have insufficient formal education, maybe have conflicting standards of practice, and people that would receive then sub-professional compensation packages. Now, when we're discussing a field's professionalization, things like minimum skills requirements and education standards, they're what are called market controls. And when there are conflicting market controls in a profession, that's called market disorder. So for all of you who are affected by the interpreting shortage, what you're seeing is the results of this market disorder play out in real time. Having a shortage of ASL interpreters actually is not a new phenomenon. There was essentially a shortage before there was even a fully functioning profession. And for the past 60 years, the field has been trying to reconcile the differences between the standards set by the profession and those set by the marketplace. Now, this issue is certainly not specific to Arizona. This is a nationwide problem. In fact, there are several other states, such as Washington, Minnesota, Connecticut, Hawaii, and Louisiana, that have either completed or are in the process of conducting wide-scale studies on the ASL interpreter shortage. Some even doing so with legislative funds that were passed in their legislature. Now, our state survey was prompted by our agency's Board of Commissioners, who were growing increasingly concerned from the reports that they were hearing from the deaf, hard of hearing, and deafblind communities about the lack of available ASL interpreters. So to learn more about this issue, ACDHH conducted interviews and sent surveys out to 5 different stakeholder groups. The first group that we reached out to was interpreter education programs. Now, these are complete post-secondary programs at accredited institutions, and happily, I can report that both of the programs participated in our study, so we had a 100% response rate, thanks to those programs. The next group that we reached out to is ASL interpreting referral agencies. So these are companies that coordinate interpreting services for a fee. So for example, if a business were in need of an ASL interpreter, they would contact one of these companies and provide details about the appointment. And then that company sends the request out to however many interpreters they have on their roster. Now, what is unique about these companies is that they specialize in ASL interpreting. And most of them that participated in our survey are local to Arizona. They're also often owned or operated by people who have close ties to the local deaf or interpreting communities. Sometimes the owners of these companies are deaf themselves or were previous interpreters. So they really kind of have a finger on the pulse of the local communities. Of the 13 referral agencies, ASL referral agencies that we reached out to, 6 of them participated. Now, the next group that we surveyed was spoken language interpreter referral agencies. These are companies that also coordinate interpreting services for a fee. However, these companies primarily work with spoken language interpreting, and ASL is just another language that's on the long list of languages that they service. Of the companies that participated in our survey, all of them are either based out of state or they provide services on a national or sometimes even international level. Now, in this group, we also included staffing agencies. So this would be like temp agencies or recruitment firms who maybe don't generally work with language interpretation, but they get hired to find interpreters for a certain contract or a certain assignment. So we included them in this group as well. Now we reached out to 19 different spoken language agencies, and 10 of them responded with just over a 50% response rate. The fourth group that we surveyed was hiring entities. Now, these are businesses or organizations that either hire freelance interpreters, or they have staff interpreters, or maybe a combination of both. We sent our survey to 71 different hiring entities, although we are aware that some shared our survey with other people within their networks. What we ended up with was 41 survey responses from this group, just under 60% response rate. Last but not least, we surveyed ASL interpreters. So we sent the survey to all 900 plus Arizona licensed interpreters, both those who reside and work in Arizona and those who work in other states, but they have an Arizona license either because they travel here for work or they provide remote interpreting services over video to deaf clients here in Arizona. We also made a special effort to include K-12 educational interpreters in this survey. Now, K-12 interpreters are not required to have an Arizona license, although some of them do. There is no registry of K-12 interpreters. So we actually have no current way of knowing exactly how many ASL interpreters there are working in the state. So we had to rely on social media and sharing throughout a few different networks to reach as many K-12 interpreters as possible. We were very encouraged to see that 325 interpreters completed our survey. So let's start off with the question of the hour. What exactly does the ASL interpreter shortage look like? So what we did was we asked hiring entities, remember those are the businesses or organizations that hire freelance and staff interpreters. We asked them how many hours of freelance ASL interpreting they request each month. And then we asked them approximately how many of their requests go unfilled. Here's what we found. Respondents from the healthcare industry came in at the top for both categories with a total of about 500 hours a month of requested interpreting services and over 60 assignments going unfilled per month. K-12 institutions were next with a total of 420 requested hours per month and 10 requests going unfilled. Post-secondary institutions reported about 315 hours of requested interpreting services a month and 14 and a half assignments going unfilled. Government was close behind with a total of 91 hours per month and 5 requests going unfilled. And then lastly, we have the courts, which came in at 63 hours of requested interpreting services per month and an average of 8 assignments going unfilled. Now, we also asked interpreter referral agencies which types of assignments were the most difficult to fill. Now, here are the results from the spoken language agencies. You can see that 100% of the spoken language agencies that responded said that last minute requests were exceptionally hard to fill. 50% of them said that assignments that require the interpreter to travel a far distance were hard to fill, and so on and so forth. Now, I should mention that some of these numbers may seem a bit low, and that's because what we found was several of the spoken language agencies that responded to our survey had limited experience with some of the more kind of nuanced aspects of ASL interpreter requests. So for example, several of the respondents didn't know what a certified deaf interpreter or a tactile interpreter was, so they couldn't answer the question appropriately. And none of them had dealt with requests for legal interpreters before. So we know that this data is limited in that we were getting responses from people who didn't have experience with the full breadth of assigning interpreters to jobs. Now, we did ask the same question for sign language agencies, and here are their responses. So you can see that about 2/3 of them said that last minute requests were difficult, 50% said that assignments with travel were difficult, and so on and so forth. Now, lastly, we asked the referral agencies about the average number of requests they get for ASL interpreting each month and the percentage of jobs that go unfilled. So as you can see, the ASL agencies average around a 5% unfill rate. Now, those percentages to, a layperson might seem pretty low, but it's important to remember that each one of those unfilled assignments is a person, possibly in an emergency situation, who is going without access to communication. The reports from the spoken language agencies were a bit more stark. Now, you may notice that the numbers for the average monthly requests look different because most of the ASL agencies chose to be interviewed. So I was able to get more detailed numbers from them, whereas the spoken language agencies filled out a survey. You'll also notice that a few of the responses for the unfilled assignments are ranges. And that's because some of the spoken language agencies, their response in their survey was something like, we can't fill most of the requests that we get. Well, if I have to quantify most, that's going to mean 51 to 100%, right? So that's why the data looks a little bit different. I should also mention that there are countless spoken language agencies that have contracts here in Arizona, including some companies that are huge, that dominate the industry on an international level. Unfortunately, those larger companies chose not to participate in our survey, so we don't have their data about their work with the deaf community here in Arizona. So that was some very basic data that we collected about the shortage, mainly from referral agencies and the hiring entity perspective. We gathered a lot more information that is included in the shortage study report that will be made available after the ACDHH August board meeting. We really wanted to make sure that there was plenty of time to review the survey responses about the possible causes for the current shortage, because that's where we're going to find the pathway to solutions. We found that many of the survey responses connect dots that some of the stakeholders out there might not be aware of. So in this next section, we're going to review some of those themes and try to connect those dots. Now, we're going to start off with what is often the first step for a person who is wanting to enter the field of interpreting, and that is with interpreter education programs. So one of the challenges that we're seeing with interpreter programs is a decline in enrollment. That's been pretty common for almost all degree programs post-COVID. Now, I am hearing reports that the numbers are gradually increasing, so that's a positive sign. However, low enrollment becomes more of an issue when you consider the potential attrition rate of interpreters. 45% of our respondents said that they have worked as interpreters for 21 years or more. Now, 21 years probably doesn't sound like a full career, but I always say that interpreters are like NFL running backs. We have a really short shelf life. The work of an interpreter is physically and mentally taxing. Repetitive motion injuries are extremely common. So it's pretty rare to find an interpreter who's been able to stick it out for 30 years or more in the field. So the fact that we have 45% of our interpreter population that has already been working for over 20 years certainly shows a need for some attention in this area for bringing new interpreters into the field. Now, many respondents also mentioned that they feel that they are seeing a diminished skill level coming out of interpreter education programs. Now, of course, during COVID, interpreting in ASL classes shifted to an online environment, as all classes did. But what we heard from interpreter education programs is that many students who took ASL or interpreting courses during that online class period seem to be consistently missing some expected language skills throughout their progress. This is still a little bit of a controversial topic, but many feel that ASL and interpreting aren't really well served in an online learning environment, and the interpreter education programs seem to have the anecdotal experience of supporting that perspective. Yet, online ASL classes at high schools and colleges keep growing in numbers. We're seeing more and more of that. Another concern is that there's more and more high school ASL classes that are being taught by underqualified teachers. So Arizona's requirements for an ASL teacher unfortunately don't ensure language fluency. And often there's no one at a district to properly vet an ASL teacher's language skills. So as a result, what the interpreter education programs reported seeing is they get students who thought that they had completed their basic ASL credits, but end up needing to practically start over again to fill in their knowledge gaps. And then there are some general systemic issues that these programs face as well. There is not any standardization about entry and exit criteria for interpreter education. There also isn't a standardized curriculum for interpreting programs. And really, the most impactful is that research shows that achieving language fluency and proficient interpreting skills, which are two different courses of study, absolutely takes more than 2 or 4 years. During our interviews, one of the interpreting program directors said, and this is a quote, "People expect interpreting programs to create certified interpreters, and that's just not possible." So what we have is graduates from these programs that may have completed the coursework, but they may still lack the necessary skills or experience to actually start interpreting professionally. The next issue that received a lot of attention in our survey responses was induction. Induction is the time period between when a student graduates from an interpreter education program and to the time that they achieve certification and can start working professionally in that field. Now, there has been a severe graduation to certification gap really since formal interpreter education programs became the normalized pathway into the field. As a society, we've really made a lot of progress in raising the bar and for the expectation of skill levels for interpreters, but we continue to struggle with bridging the limitations of interpreter education programs and the skills that are necessary to pass those certification tests. It is essentially that age-old catch-22. You can't get work without experience, and you can't get experience without working. So what we see in today's culture of interpreting is that novice interpreters, after graduation, are expected to continue developing their skills by taking workshops or working with mentors, immersing themselves in the deaf community. However, it's very difficult for interpreters to find steady work as interpreters, which can cause their skills to plateau or sometimes maybe even diminish. It's believed that many emerging interpreters are lost during this period. So, speaking of certification, the most frequent answer to what is causing the interpreting shortage in our survey was certification testing. The main concerns that our survey respondents noted was the expense and the availability of the tests, the testing pass rates, and the cumbersome testing system in itself. Now, in order to work as a professional freelance interpreter in Arizona, our licensure laws require interpreters to pass one of two testing systems, either the RID test, which you can see here in blue, or a test that's offered by the Texas Department of Health and Human Services called the Board for Evaluation of Interpreters, or BEI. Now, both the RID and BEI tests consist of a written portion and then a performance portion. You can see on the chart that the written portion for RID is light blue, the performance is the darker blue, and same for BEI. The written is the lighter red and the darker red is the performance. Now, for both tests, an applicant has to pass the written before they can move on to the performance. And as you can see, the pass rate for all of these tests hovers around an average of 50%. Additionally, each test has a mandatory waiting period before an interpreter can retest. Now, what's more, the tests themselves can be a challenge to access. So the RID written test is administered by a testing company, Major Learning. They used to be Scantron, and they have a dozen or so locations throughout Arizona. So I haven't personally heard any reports of interpreters struggling to get appointments for that written test. But the performance test, we only currently have one testing site, which is at Coconino Community College. Phoenix College used to be a testing site, but I believe they just finished up their last few appointments and they're not offering their facility as a testing site anymore. For interpreters that are looking to take that performance test, if they can't get an appointment at Coconino Community College, the next closest testing locations are San Diego, Las Vegas, and Albuquerque, New Mexico. Now, you'll see that the BEI testing fees are considerably more affordable than the RID tests. However, those tests, both of them, are only offered in a few select states, the closest to us being Texas, which means interpreters have to travel from here to Texas or another state that offers BEI testing, which means paying for travel and lodging and things of that nature. So when you add all of that together, the testing fees end up being a bit more comparable. Now, besides the expense, one of the biggest barriers for new interpreters coming into the field is just the amount of time that testing takes. So when interpreters register for the written exam for either the RID test or the BEI, there's an average wait of 2 to 6 months before the first available appointment. Now, if an interpreter doesn't pass that written exam, they have a 3 to 6 month required waiting period from their testing date before they can register for the test again and wait again another 2 to 6 months for the next available appointment date. So once the interpreter passes the written test, they can then register for the performance exam. Once again, we're seeing about a 2 to 6 month waiting period for the first available performance appointment. And then this is the one that really seems to impact people. Waiting for the results of that performance test can be anywhere from 3 to 9 months, and that's considerably better than it was about within the past year. There were people, and especially during COVID, there were people waiting a year or more for their performance test results. Now, if the interpreter doesn't pass, which again, remember, these tests all have about a 50% pass rate. If the interpreter doesn't pass, then they have a 6-month required waiting period from the performance test date. Now, sometimes that 6-month waiting period is already used up by just waiting for the results. But in general, we don't see interpreters who jump back into wanting to test again. First of all, it's a huge expense. Second of all, if they didn't pass the performance test, that means that they've got some skills that still need to be developed. And that typically takes longer than 6 months. So interpreters will work for 6, 12, 18, 24 months at developing those skills. And when they feel ready, they'll start this process all over again with applying for the performance test, waiting the 2 to 6 months for the first available appointment, and then waiting that 3 to 9 months for the results again. So all in all, it can take interpreters 2 to 5 years, sometimes longer, to pass these series of tests. And so you can see now why one of our survey respondents said that it can take over 9 years to grow an interpreter. Now, after interpreters tackle testing, their next step toward working here in Arizona is state licensure. Licensure was mentioned 47 times as a contributing factor to the interpreter shortage. It's the only topic that was mentioned at least once by every stakeholder group. So it's obvious that the impacts of licensure are really felt across the board. Now, even though all of the stakeholder groups mentioned licensure, they each had a different take on how licensure affects the interpreting shortage. So for hiring entities, they seem to be fairly unanimous that licensure was the primary or sometimes even singular source of the shortage because it limits the number of interpreters that are available to them, which of course is the message that they're getting from interpreter referral agencies, especially if they're working with out-of-state or interpreter referral agencies that service on a national level, because we know that what those referral agencies will say is, yeah, we've got plenty of interpreters available, but we don't have any available with an Arizona license. So sorry, we couldn't fill this assignment. Now, the hiring entities made comments referring to that the licensure process was too difficult, which actually could be a critique of the interpreter testing process, which is required for a state license. We're going to talk a little bit more about the difficulty of licensure in just a few minutes. When we looked at the referral agencies, especially those coordinating on a nationwide level, they definitely saw licensure as a factor in the shortage. They all noted the struggle to find Arizona licensed interpreters. In fact, one spoken language agency said, you know what, don't even bother sending me the survey. We stopped offering ASL in Arizona because we couldn't find any licensed interpreters. So that's not a service we even offer anymore. Now, when we looked at interpreter education programs, they had mixed views on licensure. They said that they valued the higher standard for quality services that licensure brings to the deaf community. But they also noted that it certainly creates a bottleneck for new interpreters entering the field. And interpreters, when we asked them about licensure, they agreed that they appreciated the raising the bar for the deaf community. Out-of-state interpreters did mention the extra administrative work for maintaining multiple licenses in multiple states, not necessarily just about Arizona. And in-state interpreters made a lot of comments similar to the interpreter education programs about how difficult licensure makes it for new interpreters to come into the field. Now, one comment that I wanted to highlight pointed out that since K-12 interpreters are exempt from licensure, this person felt that novice interpreters are then being kind of funneled into these K-12 interpreting positions. Interpreting work in the education setting has typically been a starting point for new interpreters, mainly because of the low pay and the less stringent skill requirements that school districts have. It doesn't mean that it's necessarily the appropriate place for new interpreters who are still developing skills to be. Having new interpreters in those positions not only can have a negative impact on a deaf child's education, but this particular comment noted that when they work in K-12, those new interpreters, their growth can be stagnated, and it's more common for them to experience burnout, which potentially could be pushing that person out of the field early in their career, which they felt was thus contributing to the shortage. Now, prior to this study, ACDHH has certainly received feedback from various hiring entities about how difficult they felt it was for interpreters to attain an Arizona license. So we asked interpreters that took our survey if they felt that Arizona's licensure application or renewal processes were overly difficult. And as you can see, the majority of responses showed that interpreters didn't feel that they were difficult at all. Now, this chart comes from the Institute for Justice, which is a nonprofit public interest law firm that addresses government overreach. They actually have an entire website dedicated to being the watchdog of state licensing for a bunch of different fields. They ranked Arizona 11th out of 22 in what they call their burden rating. And what that is they collect data on licensure fees and required education, cost for exams, experience that's required. They gather all of that information for all of the states that have licensure and then compare them to and rank them as to what states are more burdensome than others. Arizona lands right in the middle of the pack. We're 11th of 22. Now, that's not to say that the act of maintaining licenses for all of the states that require them is not a burden on interpreters. It definitely is. Some of the interpreters that responded to our survey reported having up to 20 different licenses from various states. So the task of applying for and maintaining all of those different states' licenses absolutely could be a barrier, but that is a barrier for all of the states that have license, not just Arizona. Now, the need for state regulation of ASL interpreting actually starts with a federal law. It's the ADA, the Americans with Disabilities Act. I'm sure that everybody here on the call knows that the ADA mandates businesses, organizations, and government agencies to ensure effective communication for individuals with disabilities with things like ASL interpreters. However, the ADA does not clearly specify who can be called an ASL interpreter. They just say that an ASL interpreter needs to be qualified. So the responsibility then falls on the states to define what it means to be a qualified interpreter. Now, this is a huge source of confusion and frustration for businesses and organizations because they're expected to determine who is qualified to interpret before those services are utilized. Now, according to RID, this is a critical point. Without a way to assess an interpreter's qualifications, hiring entities aren't given the tools that they need to be in compliance with the law. Case in point, the interpreters that responded to our survey represented 18 different credentials. Everything from state-specific certifications to specialized certificates to outdated national certifications. So without licensure, it would be completely impossible for any hiring entity to research and understand the equivalency between all of those different credentials. So what state level regulations like licensure does is it establishes standards for interpreting qualifications, not only so that deaf consumers are protected and they're receiving quality services, but also so the businesses are protected because they know that they are in compliance with federal and state laws. Now, another theme that surfaced in our survey was how referral agencies' business practices could potentially be having unintended impacts on the interpreting shortage, or what some of the respondents thought was maybe how they're potentially increasing the perceived shortage. So 88% of the interpreters who responded to our survey were reported working as independent contractors. Now, of course, that means that those interpreters freelance. They get to set their own business terms like pay and scheduling and cancellation policies, things of that nature. Now, for decades, the interpreting community has worked towards standardizing those working conditions, which is a normal step in a field that's moving toward professionalization. The trick becomes that interpreters' perspectives on industry standards can sometimes conflict with the policies and procedures from the referral agencies because they already have their own standing contracts with businesses that outline their terms of service. So what ends up happening is interpreters are often asked to negotiate terms that they may view as industry standards, either because the referral agency isn't familiar with ASL interpreting industry standards or because the agency is trying to keep the cost low because they're competing for contracts. So several survey responses posed the question, when a hiring entity is told that there are no interpreters available, is that really the case? Or are there just no ASL interpreters that are willing to work for that agency's terms? So what we did was we asked interpreters for what they felt the most important characteristics were when they were looking to work with a referral agency. So anybody out there from a hiring entity, if you work with a referral agency that struggles to meet your ASL interpreting needs, this list might give you some insights into the types of referral agencies that interpreters are willing to work for. And if those of you out there who are from a referral agency, if you're struggling to add ASL interpreters to your roster, we're hopeful that this data can help. So what we have for interpreters' top characteristics for referral agencies, number one, overwhelmingly, was that they want to work for agencies that have an understanding of the deaf community and the ASL interpreting field. Most of the interpreters prefer to work with local agencies that are primarily ASL, that primarily offer ASL services. They want to work with agencies that honor the deaf consumer's preference, that have easy scheduling and invoicing practices, and that follow industry standards. Interpreters also said that they're hesitant to sign on with new agencies, that they are most comfortable working with agencies that they already have a history with. They want to work with agencies that pay their preferred wage, that don't have any excessive requirements like fingerprint clearance cards and proof of vaccines, things of that nature. Many of the interpreters said that they want to work with agencies that value ethics over profit. And they want to work with agencies that make sure to have adequate job details and provide that to the interpreters. Now, there's another aspect of referral agency business practices that did come up frequently in our survey responses, And that is the relatively new phenomenon of spoken language agencies offering ASL interpreting services. So over the past 10 years, spoken language agencies offering ASL services has increased exponentially. In a 2013 national survey, only 7% of the 135 referral agencies that responded to the survey were spoken language companies. Yet in our survey, 72% of the hiring entities said that they have contracts with anywhere from 1 to 10 spoken language agencies. Now, it's very difficult to figure out exactly how many spoken language agencies have contracts here in Arizona. So very informally, I did a Google search for, I believe it was ASL Interpreter Arizona, something like that. And pages of agencies popped up. And within the first 3 pages, over 60% of them were spoken language agencies. And I don't believe that that would have happened 15, 20 years ago when spoken language agencies didn't offer these services. So interestingly, a market research firm did an in-depth analysis on the emergence of spoken language agencies that are entering the ASL market. And this is what their report found. They found that spoken language agencies generally have a lack of appreciation for the unique differences between signed and spoken language interpreting, and not just about the work itself, but also regarding industry standards and expectations. They found that assignments from spoken language agencies are transactional rather than relational, which is essentially at the core of the philosophy for ASL interpreting. And they also found that many of the spoken language agencies are unaware of state and federal laws regarding credentialing standards. Our survey data backed this up as well. When spoken language agencies were asked about the license level of the interpreters that they hire, 25% of them said that licensure wasn't needed for interpreting work in Arizona, or they were unaware of ASL interpreters having licenses at all. Now, we understand that we're painting with a really broad brush here. However, on our survey responses, these kinds of assumptions seem to be shared throughout the ASL interpreting community. The interpreters who responded to our survey showed that they have come to expect that spoken language agencies don't have an understanding or a respect for the unique needs of deaf consumers or the work of ASL interpreters. Many of the interpreters that took our survey expressed that they are extremely hesitant to work with spoken language agencies. And that was actually also supported by the data we received from the spoken language agencies. When the survey asked how many Arizona licensed interpreters are currently on their rosters, the highest number that was reported was 4. Now, if you remember, several of the spoken language agencies said that they are receiving 50 to 100 requests for ASL interpreting a month. So this begs the question that was brought up in our survey: are hiring entities and deaf consumers getting accurate information about the availability of ASL interpreters? There's no doubt that there's a shortage. Please don't misconstrue. But our survey responses suggested that some of the referral agencies' business practices could also be making the shortage seem worse than it is. So when a business makes a request with a company that says that they offer ASL services, if that company doesn't have a relationship with any of the local ASL interpreters, what they'll often do is collect names and contact information either from the RID's registry or from ACDHH's list of interpreters. it is extraordinarily common for ASL interpreters to receive dozens of scripted mass emails from unfamiliar interpreting companies that are just trying to cast a wide net. Respondents to our survey said that these emails are largely ignored. In fact, one of the spoken language agencies, when we asked, what do you see as a possible solution for the shortage, their response was, make interpreters respond to my emails. Now, assumedly, when this happens, the interpreting agency has to let the business know that they weren't able to find an interpreter to fill the assignment. And that results in the deaf client being told, sorry, no interpreters were available. So some interpreters that responded to our survey wondered if this process was artificially inflating the perception of the shortage. Now, along the same lines with those contractual terms, interpreters' pay was one of the most frequent responses for impacting the shortage. Of course, pay in a field is typically aligned with the complexity of the work and required skill level. For ASL interpreters, pay is also impacted by the perceived value of their work and interpreters' limited influence over those industry standards. Now, when we look at historical survey data from a 2012 national survey, we saw that 33% of freelance interpreters were making $31 to $40 per hour. 31% of interpreters were making $41 to $50 an hour. And about 15% were making over $50 an hour. In our survey, when we asked freelance interpreters their hourly rate, we see that the numbers have grown within the range, but the range itself has not grown. So what that ends up being is about an 8% increase from the average pay in 2012 to the average pay in 2024. Now, we're also able to compare that data to agencies' rates. So in 2012, about 41% of agencies charged an average of $50 per hour. 27% charged an average of $65 an hour. And 9% charged an average of $75 per hour. In our survey, we asked hiring entities how much they were paying to referral agencies. And this is their response. We found that 42% of agencies are charging $70 an hour, and 29% are charging an average of $90 an hour. And those numbers go all the way up to $130 an hour. That is a 53% increase for the average referral agency rates between 2012 and 2024. Now, the K-12 interpreters that responded to our survey overwhelmingly responded that low wages was a major cause of the shortage in their field specifically. Earlier, I had mentioned that in the 1970s, when the demand for interpreters shot up and the field didn't have enough professionals to fill the need, that underqualified people stepped into many of those roles. Many studies have been done that have shown that the public school system was probably the most impacted by that phenomenon. And the K-12 interpreting field has struggled ever since, really, to shake the paraprofessional label. So a recent study, actually it was the interpreter shortage study that came out of Louisiana, they reported that the national average salary for a K-12 interpreter is $35,000 a year. That figure hovers near the poverty threshold for a family of four. And it falls significantly below the income that is associated with middle class status here in Arizona. Additionally, because many K-12 interpreters are labeled as 10-month paraprofessional positions, they're often not offered benefits. So many of our respondents mentioned that even if, as a K-12 interpreter, even if their earnings potential was enough to live on, it's extremely difficult to set aside funds for professional development activities or certification testing. Burnout was another common theme that was found in our survey responses for the causes of the shortage. Of the 35 times that burnout was mentioned, 73% of those responses were from K-12 interpreters. Now, research shows that ASL interpreter burnout is often caused by things like poor working conditions, low pay, unrealistic performance expectations, role conflict, especially in K-12, heavy workloads, lack of support, and a lack of the public's understanding about deafness and ASL interpreting. Now, two interesting points that were represented not only in our survey, but also in tons of research about ASL interpreter burnout is the high rate of vicarious trauma that ASL interpreters experience. Studies suggest that ASL interpreters may be particularly vulnerable to this type of burnout because of the cumulative and insidious nature of what seems to be minor instances of witnessing oppression. But the trick is that interpreters don't only witness the oppression, they actually facilitate its delivery. So it impacts interpreters at a much deeper level. Burnout can also be attributed to losing trust in systems that interpreters believed that they could rely on for support. Survey responses definitely reflected a lot of anger and frustration with entities like RID. There has been quite a contentious relationship between interpreters and RID in the last few years. What our survey responses showed was frustration with the testing processes, the ethical complaint system, and their lack of organizational transparency. Now, ACDHH also received a few comments in this category, mainly due to our licensure complaint process and the fact that it is limited in our ability to hold unlicensed interpreters accountable for working without the proper credentials. Lastly, interpreters expressed just a general disillusionment about hearing consumers. So hearing people out in the world who work with interpreters and work with deaf community members. And those hearing people, their general lack of familiarity with what is necessary for effective communication. Yet, those are the people who are given roles of authority, either as supervisors of interpreters, which often happens in K-12 settings, or policymakers, or even the person making the decision about accommodations for deaf people. Now, burnout is also closely associated with working in the video relay service and video remote interpreting industries. Now, I want to take a moment and clarify some terms. So the video relay service allows people who use sign language to make phone calls to people who don't. It is funded by the federal government, so that is a service that is free to everyone, but that service can only be used for phone calls. Now, conversely, video remote interpreting is where either all parties are remote, like we are here today. Jackie here would be considered a video remote interpreter, or when the deaf and hearing consumers are in the same room, but the interpreter is remote, which is what we often see in medical settings. Now, since video remote interpreting is an accommodation under Title III of the ADA, it is the hearing person, the hearing consumer, that pays for the interpreter's time, just like they would pay for an in-person interpreter to come to their place of business. Now, these technologies offer some incredible benefits, not only for the deaf community, but for the interpreting community as well. So there are lots of interpreters who like working for VRS or VRI companies because they can have a set schedule and consistent work rather than doing the hustle of freelance interpreting. And for many of these companies, interpreters get to work from home. So there are benefits. There are some disadvantages though too. So when we have so many interpreters working from home and that are serving the nationwide deaf population, that means the pool of local interpreters for in-person interpreting assignments shrinks. VRS and VRI interpreters also endure the highest level of physical and psychological health risks, which of course have that strong correlation with burnout. And as far as the services themselves go, it's very difficult to monitor quality assurance, which is what we have seen here at the Commission with a steady stream of unlicensed interpreters popping up on VRI screens all over the state. Survey responses from the ASL interpreters about the VRS and VRI industries were raw, to say the least. This is definitely another example of where ASL interpreting has transitioned from relational to transactional. VRS and VRI companies are typically owned and operated by hearing people who have little understanding about deaf culture or the work of ASL interpreting. And at the end of the day, they're a company. They're looking to turn a profit. So what ends up happening is those billable interpreting minutes end up being prioritized over things like interpreters' health and safety and what an interpreter needs to provide effective interpreting services. So the responses to our survey saw this as a major factor in driving interpreters out of the profession. In fact, one of the respondents described it, and this is a quote, as interpreters being consumed and discarded at rates high enough to make a significant impact on the shortage. In fact, there was recently an unofficial poll on a local interpreter Facebook group, and the results showed that 93% of the interpreters said that they would never go back to working in a VRS setting again. So that was a lot of doom and gloom. I'm happy to report that we also asked people what their ideas were for solutions. So let's take a look at what they said. The number one answer for solutions had to do with interpreter training, specifically for a structured mentorship program that pays mentors and novice interpreters. They also, let me go back for 1 second, maybe, there we go. Respondents also discussed the need to raise the qualifications for high school ASL teachers so that students who are taking those ASL classes can have a more meaningful language exposure. And that potentially could mean they're more prepared when they go into the college interpreting program, which then could reduce that graduation to certification gap. As far as interpreter testing goes, there were lots of suggestions that unfortunately fall outside of ACDHH's purview, like changing testing protocols or the mandatory waiting period. We don't have control over that, sorry. But some achievable ideas were to offer scholarships or grants for interpreter testing, more test prep workshops, and also to increase the availability of interpreter testing here in Arizona. As far as policies and regulations, survey respondents called for state policies to hold VRS and VRI and interpreter referral agencies accountable for their business practices. And there were some comments that suggested forming an interpreters union. On the recruitment side of things, several of the respondents suggested doing somewhat of a PR campaign to recruit interpreters or recruit people into the field of interpreting. There were lots of different ideas about what to change with licensure. One of the most frequent was to set up reciprocity with other states' credentials, and then also to amend the provisional license period so that it's less of a barrier for new interpreters. Several people talked about educating people in the public about inclusion in general and communication access, so as to maybe make a more supportive environment for interpreters to work in. And lastly, many people suggested the need for stakeholders to collaborate, for everyone to come to the table and connect these dots. Several of the responses also encouraged businesses that use ASL interpreting services to invest in the solutions. Now, ACDHH is very happy to report that we're already spearheading several of these initiatives. We are currently developing a mentorship program, and we're definitely working to bring more test prep workshops to Arizona. We've also created a searchable database of nationwide interpreter workshops. Many of them are test prep workshops, so interpreters can find all of the professional development they need in one place. We've been giving presentations to Arizona high schools that offer ASL classes and encouraging those students to consider interpreting as a career. So far, we have presented to 8 different schools and hundreds of students. We do regularly give presentations to students at colleges throughout Arizona about working with deaf, hard of hearing, and deafblind communities. And we've actually recently developed a partnership with the Department of Ed to bring these presentations to high school students that are in the career and technical education programs. And lastly, we really hope that this town hall and the results of this study will be a jumping off point for further collaboration, that all of the stakeholders can come together and figure out where are the bottlenecks, where are the pain points, and how can we address those issues. Now, we know that a lot of those solutions from the survey are kind of more long-term goals, so we wanted to be sure to share some short-term suggestions as well. Recently, the National Deaf Center published a list of recommendations for navigating the ASL interpreter shortage, specifically for college campuses that work with ASL interpreters. So what we did was we took that list and we amended it a bit to offer some short-term suggestions that you as stakeholders could consider implementing. So here are some short-term suggestions. First and foremost, listen to, validate, and support interpreters in their work. They are the subject matter experts about their work, so believe them. Definitely learn more about the ASL interpreter request system that's used at your institution and see if there's ways to reduce the complexities in that request pipeline. Consider hiring staff interpreters. The hiring entities that took our surveys that have staff interpreters, as you can imagine, had significantly less challenges filling ASL interpreting requests than those that relied on freelance interpreting alone. Consider contributing to scholarships or training programs that will eventually benefit your business. Take a look at the contractual terms with any of the interpreter referral agencies you work with and reach out to the interpreting community. Ask them if those terms reflect the industry standards and reflect policies that they're willing to work for. If your business works with interpreters often, consider providing a dedicated office space so that interpreters can take remote work assignments there in between in-person assignments. Now, if you work in a field that's highly technical or somewhat niche, and it's difficult to find interpreters who feel qualified to interpret there, think about offering some free workshops with CEUs. ACDHH can absolutely help with that. In general, super important, absolutely include the deaf community anytime that you are developing policies about services that are going to impact them. And lastly, feel free to contact ACDHH. We can provide free consultation on any of these things, and even take a look at the situations that you and your business are facing from specifically and individually, and see if we can't find some ways to smooth out any bumps in the road with getting the services that you need. All right, we're going to move into the Q&A, but first I want to take a 5-minute breather so that our interpreters and CART teams can take a bit of a break. This would actually be a great time too to get your questions into the Q&A. I will see you in 5 minutes. Okay, welcome back. I hope you were all able to get a snack or a drink or a potty break or whatever you needed. We are going to start the Q&A, and I'm going to stop sharing my screen. So please remember, you can type out your questions in the Q&A by using the Q&A button at the bottom of Zoom, or you can raise your hand if you want to come on screen and ask your question that way. So hang on one moment while I stop sharing my screen and get myself a little more situated. Okay. All right, I am going to start with a question that actually wasn't in the Q&A. I happened to see a comment that was made, that was sent to me directly in the chat. And it was about that hospitals are typically using deaf patients' insurance to pay for interpreters. And that is a really important topic that I'd like to address. So it is true that there are some insurance providers who will pay for interpreting services. What we have seen is that there's positives and negatives to this, right? We think it's great that there isn't a barrier for getting an interpreter as far as who pays, right? We all know that oftentimes with doctors' offices who aren't aware that it's their responsibility to pay for interpreting services, there can be a lot of hurdles to educate medical providers that it's their responsibility. And when an insurance company steps in and says, we'll take care of it, that reduces the amount of time it takes to identify those hurdles and get that medical provider the information that they need, right? So that part is great. Here's the problem. You don't have any control over what referral agencies that insurance company is contracted with. Usually they're spoken language agencies at the national level, and you have no idea whether they know about Arizona licensure, whether they respect the credentialing practices of our field, if they're going to send a qualified interpreter, or even if they have any Arizona interpreters on their roster. So by going through insurance companies, it really takes the provider and the deaf patient, who are the two who are going to be receiving the services, it really takes them out of the equation with getting the types of services that they need. We had one hiring entity who responded to the survey that mentioned insurance companies paying for and coordinating interpreting services. And they said that every time they go through the insurance company either can't find anybody or they send the wrong type of interpreter every time, because there's so many more intermediaries in the pipeline of requesting that interpreter. What's more, this is an additional issue that we've seen come up, is that medical facilities have started believing that if the insurance company can't provide the interpreter, then that's it. There's nothing more for them to do. That the interpreters come from insurance companies, and if the insurance company can't, then I guess we don't have an interpreter. They're not aware that the law, to the best of my understanding, it is still the medical provider's responsibility to find the interpreter. And we've actually worked with several insurance, I don't know what they're called, like the insurance providers under Access, our state Medicaid program, who have been trying to educate the providers in their network that if the insurance company can't provide the interpreter, that doesn't mean that that provider's responsibility is over. It's still their responsibility to look locally for an interpreter, but most providers don't know that. So they're relying on insurance companies who may or may not have the resources. We have no idea. And when the insurance companies don't come through with interpreters, they just kind of wash their hands of the issue and say, sorry, the insurance company couldn't provide it. So too bad, good day. So that's definitely something that I'm glad somebody brought up in the chat and was brought up in the survey as well. Okay. Going on with the Q&A questions. A question was put in the Q&A, why isn't ACDHH working on revisiting and revising licensure requirements? Actually, ACDHH is all the time. However, they can only do that during certain periods because it is legislation. They have to follow this certain legislative process. So every 4 or 5 years or so, you'll notice that ACDHH will start reaching out to the community and saying, give us your public comments about things to consider with licensure. A few times, ACDHH has had to make those kinds of changes due to changes that were out of our control, like changes with RID and things of that nature. So the problem is that we don't get a lot of responses. So I hate to kick that kind of thing back on you, deaf and interpreting communities, but when you see like open comments periods open about licensure, that's your time. That's your opportunity to get your ideas in, get your comments into us, because that's the time that we're allowed to essentially open up our rules and investigate what kind of changes need to be made. Friendly reminder, if you have, I'm noticing that there are some chat messages popping up, and I think that they might be being sent directly to me. I'm not monitoring the chat, so if you have a question, please make sure to put it in the Q&A. The next question is, what does ACDHH plan to do about agencies, and when will agencies, what does ACDHH plan to do about agencies, and when will ACDHH require licensure for agencies? That, I believe, is I don't know. Does Carmen or Nikki want to pop in and comment about that?
Hi, this is Carmen. For the licensing of agencies, you're also looking at another governmental process where we would have to receive legislative authorization to license agencies. So essentially, it would look very similar to what it looked for those of us who've been around for a while, when licensure was first introduced. You would have to have met with those partners and stakeholders and come to some type of common ground that this is the appropriate thing to do, that it is not overly burdensome. We'd have to go through essentially a legislative process in order to have the authority to license agencies. And the commission has not taken on that challenge as of yet. There have been discussions, conversations about it. And again, our best bet for doing something like that is being able to have some type of consensus between the communities, all stakeholders, and those business owners in order to even possibly be able to license those agencies. So it's a continued discussion.
Thank you, Carmen. So maybe this is, I know that is a hot topic, and that there are lots of interpreters and deaf community members who have talked about the need for some kind of oversight for interpreting referral agencies. Maybe this survey and the data in this presentation, maybe that's a start, if that's something that the community can come together and push for. The next question is, based on the information that we gathered, will ACDHH consider reciprocity for licenses from other states? My understanding, and Victoria Vaughn, our licensure and compliance manager, is joining us today. Jump on if you have anything to add. But my understanding is that we constantly look at the criteria for licenses from other states, and many of them are they don't meet or match the criteria that we have for our license. It's very difficult to find reciprocity. Victoria, do you want to take it from there?
Perfect. Hi there. So yeah, that's exactly it. The main issue with that is that every state that does have licensing or certification does have the different qualifications, and they vary and all across the chart. So that to tackle that would be something that we have not put off the table, but it's going to take a little bit of more of thought process and planning for that if we do move forward with that. Right now, we are focusing our efforts on working with our interpreting agencies, the hiring entities, to work with them to say, why aren't all of your folks that are on your roster Arizona licensed? What can we do to help that? To streamline that process, we're finding more of a impact doing that right now than going the route of reciprocity of licensure or universal licensing. So that's where we're focusing on right now.
Thanks, Victoria. I see a question from Ramiro asking for statistical data on the number of ASL interpreters that have obtained an ACDHH license in the past 5 years. Ramiro, we're certainly happy to get you that info. I don't have it on the tip of my tongue right now, but we can certainly get it for you if you don't mind emailing us. We'll be happy to get you that number. Shelley asked if we've been in contact with any of the other state commissions to share our results or to see if they're facing the same challenges. We definitely know that they're facing the same challenges. There is quite a bit of research that was taken let me back up and start over. In our shortage report, some of the research that's in there is actually borrowed from other states' research that they've already done. So as I mentioned, lots of other states are doing needs assessment reports like this. So we know that it is a challenge nationwide. Certainly happy to share any of our data with other states and other commissions. This comment says, the increase in interpreter wages versus the increase in the agency's rates is alarming. While many are not aware of the work that goes into the back end of agency work, and that does deserve some compensation, the proportions of increase are still far in favor of agencies over interpreters. And particularly in a current environment that feels like agencies are not providing internal customer service and are merely placing bodies via automated systems. That is a feel that we got from the survey results as well. This comment said, I noticed an emphasis on high school ASL teachers, but little discussion of college ASL instructors. Do you have any data about how ASL instructors in college or universities partner with interpreter educators to ensure students are ready to start their interpreter training programs? Most ASL is taught at the college level. Shouldn't we be looking at that more in terms of language development and readiness? So ACDHH actually had a task force a couple decades ago, I believe in the late 90s, early 2000s, about the qualifications of college ASL teachers. And what they found was that the community colleges and other universities that were offering ASL classes, their criteria for teaching ASL were more stringent than certifying bodies like ASLTA. So at the time, the commission felt that it was appropriate to let those colleges and universities continue doing what they were doing because their requirements were satisfactory. I will say, I don't know that most ASL is taught at the college level anymore. It is wonderful how many ASL classes are popping up in high schools. It's wonderful. It is equally concerning of the qualifications that are necessary from the Department of Ed for teaching ASL at the high school level. And as I mentioned from the study results, the interpreter education programs are seeing results from this, and it could, where the fear and the experience so far is that sometimes students are so frustrated that they don't get to just jump into ASL 4 or whatever, that they leave the field altogether. So there are unrealistic expectations coming out of those high school classes, which are growing more and more, when that could potentially be a great opportunity to get those students language exposure that would make the interpreter education process in college so much more effective. But there isn't really any metric for measuring the efficacy or the linguistic knowledge of high school ASL teachers, which it has come up as a potential issue. This question from Deborah: with a decrease in the legally certified interpreters, has the issue of the shortage of legally certified interpreters been addressed? Many will be retiring in the coming years. That's true. Is there a way to focus on developing more interpreters who have that skill and competence to work in legal settings? So, Deborah, this is a great question. Is there a way to focus developing skill? Absolutely. We, at least here at ACDHH, we have been actively working towards bringing more legal workshops and things of that nature to Arizona. Phoenix College is about to hold a special topics class in for legal interpreters, or those interested in becoming legal interpreters, and ACDHH is offering the CEUs for that. We're bringing educational and professional development opportunities, not a problem. Where we see the big challenge is that currently RID still has their legal certification test under moratorium. It's never come out of moratorium. And there's no, from what we can tell, it is pretty much on the back burner. They're searching for funding, and last reports I got, they weren't having a lot of luck. So it does not seem like the RID legal certification test is something any of us should hold our breath for. That means that the BEI legal test, which is called the CIC, the Court Interpreter Certification, the CIC is the only legal test that's now available to interpreters with an Arizona license. The issue that we're seeing with the CIC is that in order to sit for it, an interpreter either needs to have an NIC advanced or an NIC master, which, to those of you in the interpreting field, you know that those are credentials that RID hasn't offered since, I believe, 2016. My year might be off on that, don't quote me. So since most of the interpreters working in Arizona have an RID certification, like the NIC, what that means is they would have to travel to Texas at least 3 times to take a series of tests to make them qualified to just sit. Hold on, I'm saying that wrong. An NIC, so I'm trying not to use, I used general terms because I know that there's a lot of non-interpreters that were going to be joining this call. And I know how confusing it can be with alphabet soup. So to clarify, the RID test that's available right now is called the NIC. When the NIC was first launched, it had levels. So a person took the test and they would get their results, and if they passed, they were either NIC General, NIC Advanced, or NIC Master. very shortly after that, RID went back to the drawing board and said, this test is no longer valid and reliable. So they switched the test to just being an entry level. If you pass, you get an NIC, the end. The BEI test will only let you sit for the CIC if you have either the advanced or the master level, which has not been offered for years. So for an interpreter with an NIC RID certification, what they'd have to do is travel to Texas to take the written, come back, hope to pass, travel to Texas to take the performance of, the NIC qualifies you to take the BEI advanced. So travel to Texas, take the BEI advanced, hope to pass. Then you can take the written legal test here in Arizona. That part's good. And then travel back to Texas a third time to take the BEI performance legal test. So that seems to be more of a barrier, that interpreters who are overwhelmed with work are saying, I've got plenty of work, and that sounds really ridiculous. That is a lot to put into getting a legal certification. So that's what we see as the biggest barrier, at least here in Arizona, where legal licensure requires passing either the RID legal test, which is no longer, or the BEI legal test, which is a gauntlet. One question came in that says, has ACDHH done an audit of themselves and explored why there are low response rates? I'm not sure what that means. Low response rates to our survey, or low response rates to what? If you ask that question, I would love for you to pop on and clarify for me. Oh, I see one hand raised, but I don't know who it is. So whoever you are, mystery hand, feel free to pop your camera on. I'm trying to find you in the participants list. Ah, it's Jennifer Wyman. Jennifer Wyman, you want to pop on?
I'm like the second time doing this.
Thank you for coming back for more.
I'm just going to talk. Yeah, back for more because I didn't realize we're CEUs. So I wanted to say something. Hold on. Let's see. We're all just doing this all last minute crazy, but about the BEI, I wanted to say I'm actually registered for the BEI Advanced. Oh, now y'all know. And I actually was able to skip the BEI Basic because I have the RID CT test and CT only, and they let me skip the BEI Basic. So I just want to let you guys know that I do have to fly to Texas. I do have to take the written before, but I'm supposed to be able to take the written, and then the very next day, if I pass, take the advance. So I just want to let you guys know that that's a thing. So if you just have the NIC, you should be able to, or a very old test like mine, you should be able to just take the BEI advance.
That's correct. So if you have CI, CT, or NIC, you can sit for the BEI advanced. That does mean taking the BEI written, and then of course the BEI advanced performance test. And as Jennifer noted, there are 2 times per year where BEI in Texas allows interpreters to come and take both tests in one weekend. So you can avoid having to go there and come back and go there and come back. That's great. It's very hard to get an appointment though, because there are lots of states that accept the BEI and lots of people trying to get to Texas to get one of those appointments. So if you're lucky enough to get one of those like 2 tests in a weekend appointments, groovy. So yes, thank you for that, Jennifer. Appreciate it. I see Melanie Ananya has her hand raised. Hi.
Thanks for putting all this on. I appreciate all your efforts. And did you see how Zoom just made my thing bigger like you were
Me
talking
too. It's driving me crazy.
about.
I'm glad
So
to know it's not just me.
it's their settings for webinars. So weird. Anyway, my question to you is a follow-up on the question about legal. Just from your answer, I used to do some court stuff in another state where we have a different process. So as somebody who is interested in doing that here, I would just never go through any of that. And I'm pretty sure probably no one will. You couldn't even articulate it because it's so complicated. So since there have been some very clear changes in RID and the way that things are written for BEI, what is happening with changing the requirements for legal qualification here in Arizona when it's very clear that the certification from RID is not coming back? Nobody, what, 1% of people are actually going to go through that process? Like you said, my schedule is full. I don't have to do that work. I would like to, and I have a ton of qualifications, but what is happening around changing what you guys have in statute, just like you had to change immediately when RID got rid of their cards, you guys were able to make a change in language right away. So why isn't that same thing happening with the legal qualification portion of licensure here in Arizona?
That's an excellent question and just a little out of my purview. Does Carmen or Victoria want to pop on and
Not my thing.
I'm a little low on the pay grade. Great. Excellent. Thanks, Victoria.
No problem. So we haven't made any changes yet because we've been hopeful. So we've heard, things about different tests or things being developed, or maybe this will come back or that certification will come back. All of those don't come to fruition, right? And then legal interpreting is a beast, as you know, you've worked in it before. So to change that, we would want to do our due diligence and research and figuring out what to change, how to change, what will be the impacts to our deaf community. If we make the change, will interpreters then take those jobs in the legal setting? We had emergency rule change a couple of years ago. And long story short, we changed our qualifications to say we would like all of our legal licensed interpreter to have X, Y, and Z certification. Some of them didn't have it. So we allowed a year or two, and I want to say more than 2 years, about 3 years, to get that certification. We asked everyone, we surveyed. They said, yes, if you give us this time, we will get that certification. We'll do the legal interpreting. It came down to that date, and the numbers did not reflect accurately those who said we will work in that setting. We will get the certification. We will do it. We will. So we're dealing with the testing issue. We're dealing with the potential impacts to our community, and then our environments have changed greatly. Interpreters simply don't want to work in that setting for the most part, from what I'm understanding, regardless of the licensure. As you know, that's an intense setting. So carefully looking into all those factors to make a impactful and a decision that won't negatively impact everyone. We're going to take our time and figure that part out. But there's many different areas to that. So that's why the changes haven't been made, because we're waiting, hopefully, and then the impacts of it are just, as you know, astronomical. So trying to figure out that balance.
Sure, I understand and respect that. And also, like, has the research been being done? Because we all know that RID is not bringing back the SCL like anytime soon. And that's been apparent for many, 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 many years. So while you've been in the hopeful mode, have you already been doing that research on things? Because, as the other person said, who has way more experience, people are just coming out of that. So, and then
Yeah.
Thank you.
Yeah, definitely. Yeah, I've been in having some discussions and some inklings of other tests that may be coming up to replace that, not through RID, but other entities. So trying to, it's a game of chess, I guess, trying to figure that out. But yes, the research is being done. We're actively monitoring it. We work closely with our Arizona court systems, the language coordinators and the interpreter coordinators in the Arizona courts. They partner with us and keep us abreast of things that are real time, what's happening, the challenges. So we are actively researching, working, and
Last question for real. Do you have a timeline for that other than like, what is the timeline before action is going to happen?
That I can't give you. I don't have that right now. But we won't. And the thing is that once we have a better scope of what we want to do or will do, we'll definitely reach out to the community of interpreters. We won't make decisions without getting feedback and figuring out what works best for everyone. So we'll keep everyone abreast. But right now, I do not have a date for you.
I will say, to piggyback on this information, some of the data that was included in the report that will be made available after our August board meeting showed that of the interpreters who responded to the survey who had a legal license, they spend very few, like a very small percentage of their working time in legal environments. That brings up questions for me. I don't know. There wasn't a way to ask why, right? Or I didn't ask why. So there are resources, but they're not being utilized for those legal environments. It would be curious to find out why. Is it that those interpreters are just already booked with non-legal jobs? Should we be considering holding legal interpreters on some kind of paid retainer for those legal jobs? And if so, that just sounds like a staff position to me. So should the courts just be hiring more staff person? So it's a multifaceted issue for sure. Oh, I see David Svoboda has his hand up, and he probably has all kinds of insights about courts. David, you want to pop on?
Yeah, hi, Cameo. I just wanted to touch on the comment about staff position for interpreters in the courts. But you and I have had this conversation previously in discussions, and we appreciate the work that the commission is doing and outreach that you've been undertaking to understand the issues that courts are facing. Specifically as to staff positions, there is but one court in the state that I think has enough demand to actually have a staff position, and that one court I think held their staff position open for 4 or 5 years recently, trying to get people to take a job there, and they weren't able to fill it, so the position went away. While there may be demand statewide for centralized ASL legal A position to assist courts around the state, there is no centralized funding mechanism for the states to provide that service. So we're also confronted with the fact that we are a decentralized system where every court is funded at the local level. And then those services would have to be provided, even if we did have that position available in a centralized location, through VRS or VRI, which are not desirable delivery mechanisms for providers or recipients. So, I mean, it's kind of a triple whammy there when we keep coming back to this idea of have a staff position, and that will solve the problem in the legal environment. At the end of the day, it doesn't, because we just don't have the resources to set it up or the delivery mechanisms that are attractive to provide those resources. So the courts are really struggling. I know this is an issue that you and the rest of the folks at the commission are well aware of, and there are a number of court staff around the state that are on this call right now. They're well aware of it too. So we are very interested in continuing the partnership that we've had with ACDHH to figure out, what needs to be done and what can be done. Excellent.
Thank you. And I hope that other representatives from other stakeholder groups have David's commitment and are motivated to continue these kinds of conversations. That's what we're hoping for here, because my guess is that many of the stakeholder groups here today maybe weren't aware of kind of how the sausage is made, right? And what that entire pipeline of getting that interpreter to you looks like. I think that the only way that we're going to find a reasonable solution to any of this is if we come together, and that is ACDHH's hope, is that we can come together and understand each other's perspectives. We only have a few moments left, so I know that there are a ton of questions in the Q&A that we didn't get to. I'm so sorry about that, but we're going to capture all of them and respond to you if we have an answer. Also, if you have a question that you want to just email to me, feel free. Hold on, I'm going to share my screen again and show our contact information. Okay, so here is our contact information at ACDHH. Please feel free to reach out to us if you have ideas, if you want to be connected with other people, if you have more questions, honestly, anything. We are happy to support you in whatever it is you need to try to find solutions to this issue. Also, keep your eyes peeled for the interpreter shortage study report, which again will be made available to the public after our August board meeting. We can't thank you all enough for taking a vested interest in trying to understand this issue and figure out how to provide better access for our deaf, hard of hearing, and deafblind communities. And I think together we will be able to figure something out. But it's got to be there's no one entity, because it is so complicated and multidimensional. So it's 2:00 Arizona time. I want to thank all of you interpreters for CEUs. I will be sending out an evaluation, like a workshop evaluation. You don't get any other form or anything. Your registration has got you set. And other than that, please reach out and thank you. Thank you for your time and your interest in this issue. I appreciate you all so much. We'll stick around for a moment or two if anybody has any last burning questions. But other than that, thanks for being here today and have a great day. And we hope to hear from you soon.